Yes.
Where are we?
Here.
Why are we here? Not entirely clear. We are misfits thrust into existence by random chance, with no hints at all as to how we're supposed to make sense of it all. It's immensely bizarre. Here we are.
Hello, everybody, and welcome to the Here We Are podcast. I am so excited. You guys are excited. Haven't done a COVID episode in a couple months for no reason in particular. It's just the way that it works out sometimes. And I know in the Discord, on the message boards and stuff, you guys have been asking for another one. So this is actually, we don't have an academic today. We have a journalist joining us today. I'm very, very excited. Author of the new book, which just came out yesterday at the time that this podcast is releasing. It is A Shot to Save the World, the inside story of the life or death race for a COVID-19 vaccine. Gregory Zuckerman is joining us today. Gregory, thank you so much for joining the show.
Oh, it's a lot of fun. Thank you for having me.
We figured out Bluetooth together. It's been, Gregory, I used to record every single one of my podcasts in person. A little background. I'm by trade a stand-up comedian. I also do science communication as well. But I started this podcast when I was touring around. I would look up local universities and be like, oh, that seems like an interesting topic, and go and talk to scientists about it as like a fun little hobby. And then it turned into the thing that I care about more than comedy. And so normally we would have been doing this in person. And since COVID, I've been dealing with tech issues every single week and teaching various people how to use headphones and things like that. And so we both got to learn a bunch.
We all have a contribution to make to this world. Do you find that scientists try to make jokes with you and try to impress you with their humor, or no? Because I got to figure out whether I should try.
Well, there's a few things that happen. One, people are nervous that there's an expectation for that, which there's a not. I mean, we talk about like MS and cancer and all sorts of like hyper serious subjects and stuff. So it's always there's different ways that different personalities react to finding out that I'm a stand-up comedian. And one, this is I consider this a science podcast. That's how it's listed on iTunes and everything else. It's not a comedy podcast. But sometimes people are like, ooh, can I swear? So, sometimes you get that, and which the answer is yes. I don't, but because I don't want to make my guests feel uncomfortable if their kids are watching or something. But sometimes people get excited that they get to speculate a little more, be a little looser, maybe drop a F-bomb from time to. And then the other side of it is people are very nervous that there's an expectation to be funny, which there isn't at all. And so if we happen to have a laugh or two along the way, that's I would say that this isn't any funnier than any other normal podcast out there. Or at least that's not my intention when I go into it, but sometimes I can't stop myself. So talk about, first of all, what's your background?
So I've been at the Wall Street Journal since 1996. That's a long stretch of time, quarter century. Most people don't stay at any one business, let alone a newspaper or media property that long. But I've done all kinds of things here, and they've allowed me to roam. So I love it. I mostly write about business topics historically. I've written about markets related, big investors. I now am in part of an investigative group, so I do investigative stories, dig into malfeasance and successes and all kinds of things and share the world. So I'm something of an investigative reporter, and I became sort of obsessed, as I kind of do, with the chase for the vaccines early on during the pandemic, partly because it provided a bit of a distraction, I think, for me. We were all trying to deal with our new world, and I had kids who were in school and had to come home, and, we're all a little bit nervous and concerned. And it gave me something to almost distract me and root for. And I'm in a vantage point where I'm lucky. I'm grateful. I get to talk to the players, the people that were chasing the vaccines from all over the world, and some succeeded and some failed. And I thought I'd track their progress and chronicle it in this book I've written. So that's kind of what I threw myself into.
That is so cool. Yeah, I've been, I had, when COVID first started, I was fortunate enough, I'd reached out to past, epidemiologists and stuff that I'd already had on the show. But I think maybe a good 6 months before COVID, I had this just incredibly brilliant person on a live show where I combined comedy and stand up. And I remember her name's Nina Pfefferman, and she gave a talk about mathematically. She was a theoretical mathematician, became an applied mathematician with epidemiology. And I remember it was just another show. I did like 3 of these shows a week. I had 2 scientists on each show in a different city. And it never even really, did the show. Nice to meet you. See you later. Yeah. And then COVID came around and I was like, oh, wait a second. I should have paid a little more attention to.
Well, it's not just you. So I write in my book about how there were all these conferences, events in January of 2020. There's a famous one, the JP Morgan Biotech Healthcare executives from all over the world come to San Francisco. We're talking tens of thousands of them, investors, executives. They all packed into these rooms, conference rooms, suites, etc., in San Francisco, and without being too concerned, nervous. These are the experts. These are the people that try to anticipate the future of the healthcare world, the biotech world, etc. And there were all kinds of events I write about like that. So January, as late as January, late January of 2020, they too weren't even too concerned about this emerging virus.
Yeah, so my first experience was so it was this show Stand Up Science that I was often touring with, but I did other shows as well. And so there was about 2 months in like December, January, I wasn't really talking with scientists like I normally do because I was doing other shows. And then early February, I was going to do a show in Phoenix, and I remember Glendale, Arizona, and a biologist was like, yeah, there's this COVID thing that I'm worried about. I'm just not sure that I'm comfortable being in a room with people right now, and it canceled on me last minute. And I was like,
wow.
Okay, whatever. I had never even heard of COVID at this point. I don't watch the news. I like listen to audiobooks in my car, and that's it. Yeah. And then I was like, well, if you still want to record a podcast with me, I can. And she was like, yeah, maybe. And I go to people's home or office, and she's like, being weird about it. I'm like, I don't know. Do you want to come to my Airbnb? Like, what? I didn't understand where she was coming from. And she's like, well, maybe we could record outside. I'm like, outside? There's like noise issues and stuff. No, I can't. And she's like, maybe I could do a conference center in the university, but you'd have to promise to not get within 6 feet from me. And like, we couldn't shake hands or anything. And I'm like, you know what? Crazy hypochondriac person. Why don't we just do this the next time that I'm through after all of this has blown over? And she's like, okay, fair enough. But, you should probably stock up on some necessities and stuff, because I'm telling you, once this comes through, there's going to be some panic, and like, who knows what there's going to be shortages on. And I'm like, all right, I guess that was an interesting experience talking with that lunatic. And sure enough, within 2 or 3 weeks, I was like, oh, this is a real thing that's happening.
Yeah. And it definitely was.
So what were those early days from your point of view, from your investigations? Did you investigate any of like the early kind of alarm calls that were done at the time?
So I spent a lot of time figuring out what the different approaches were. So obviously today we realize there are two, more like three successful approaches: the mRNA one, the ad vector adenovirus vector, viral vector approach, which led to J&J and the AstraZeneca approach, and then Novavax protein subunit. But we all know that there are other more traditional approaches to vaccines, and there are many that were early on rolling up their sleeves trying to get funding there too. Attenuated, killed, etc. They're more traditional approaches that we're familiar with that have led to all the mumps, measles, all the kind of polio stuff in the past that we all are familiar with, those chases, those events. So anyway, so I tried to understand all the different approaches, including the successful ones and ones that ultimately we haven't heard much about. So we're talking the big companies and what they were up to, what their plans, what their goals were, but also little tiny universities and outfits and different organizations that also early on were pretty ambitious and hopeful. And they had promising ideas, but they didn't really pan out.
So, there must have been, because often when people consider, you hear quite a bit of, I post various things on social media. You hear a lot of people talk about the financial incentive and look how much money these companies are making off of these things. And I think that's true when you're successful, but there's a lot of people that I'm sure had a lot of investments along the way. There was a lot more companies that invested along the way that things just didn't work out for them.
That is very true. It's important to remember, but it's also important to remember, and I emphasize it in my book, that vaccine work was not very popular until 2020. Companies who wanted to focus on vaccines were discouraged by their investors, by their backers. We all know that therapeutics, drugs are much more profitable, can be more successful. You know, you take a statin and you keep taking the statin throughout your life, whereas vaccines, and I start off my book going back into the chase for an HIV vaccine. And back then too, you had some of the bigger players, pharmaceutical makers, who wanted to discover a vaccine, but it wasn't mostly those guys. There's a little tiny company called Microgenesis that I focus on early on in my book. And for that reason, I think it emphasizes the point that it was these kind of smaller, more ambitious companies, less conservative, that could chase these vaccines because there was limited potential upside and a lot of downside, a lot of opportunity cost, a lot of wasted time. And I write in my book about how Merck, one of the vaccine giants, sort of dragged its feet on COVID-19, didn't really want to if it fell in their lap, great, but they didn't really want to spend too much time chasing the vaccine. So that's one thing I don't think people appreciate. Now, obviously, Moderna and BioNTech they have piles of cash, they have piles of profits and billions, and people are saying maybe too much, et cetera. But again, until 2020, vaccine work was not very sexy.
Yeah. It's just not there's boosters and everything, but mostly one and done preventative treatment with not a exceptionally high profit margin is not, when you compare it with something like antidepressants or Viagra or anything else like that you're taking regularly.
And frankly, they may have changed. Now we're in this new era of vaccines. We just have one approved for malaria. There are others coming, I believe. Both malaria and other kinds of illnesses and pathogens. But that, again, this COVID in some ways, COVID-19 has changed everything in terms of pharmaceutical industry, biotech industry, and the view of vaccines by investors.
That's really interesting. I would love to talk a lot about that. But first of all, I let my guests steer the ship, and I haven't read your book yet. It hasn't come out at the time that that I'm recording this. So I'll let you kind of start how you want, but I would really love to know a little bit about how that change that has created what the pharmaceutical company industry rather looked like before the COVID-19 vaccine, and how you think it looks now, and what that might mean going forward in the future.
Sure. So I think it's really important to keep in mind that the three biggest vaccine makers going into 2020, going into COVID-19 and the pandemic, were GSK, Sanofi, and Merck. And not one of them has produced a successful vaccine for this pathogen. And I think it's for important reasons. The big guys who you would have expected to save us, these are the kind of companies and efforts and scientists that we usually turn to and have produced all kinds of vaccines that we rely on today. They had an interest, I think, in pursuing COVID-19, but we need to remember that going into 2020 and in early 2020, the consensus view of experts was that we could maybe find a vaccine in a year and a half or so. I think that's what Tony Fauci said at one point. That's what a lot of scientists I talked to at the time, and I quote in my book, said that to expect an effective, a protective vaccine in the next, 6 months to a year was pretty unlikely. And yet 330 days or so after the sequence was released, we had a vaccine. So I think we're so close to it that we don't appreciate yet how remarkable this achievement is. I mean, to me, it's the most historic achievement of modern science. And we really are going to look back and appreciate it, but we're too close to it right now. So getting back to your point, vaccine work was not very popular going into 2020. And it really took some outsiders, some really unlikely characters, scientists, researchers to develop these life-saving vaccines.
Yeah, I've made this. I was talking with a friendly acquaintance on social media when I got my vaccine, because I was just so not just that I was getting a lot of protection from COVID, but it just felt like I was part of, like you said, one of the greatest scientific advances of our time. And to me, it felt like it. I mean, you can't see viruses anyway. Humans have always had a hard time with germ theory and appreciating it, and even figuring out the new. In the last week, I've been around multiple people that have referenced, like, dropped something on the ground, like a piece of food on the ground, and like, uh-oh, COVID. Like, no, you aren't quite getting how this game has changed. How you aren't quite getting that this is a respiratory virus. And and people have a real hard time. And the idea of getting someone on the moon or something like that is like neat and terrific, and it's easy to see, and it seems just like easier for people to appreciate in a way. But to me, this mRNA vaccine, especially, not just because of COVID, but what it might mean going forward in terms of what it might do in potentially treatments, or the potential in our battles against cancer and things like that. It's just so exciting. Yeah. And someone was just like shocked to hear me say that. Like, This is like a vaccine is just something you begrudgingly take a chance at getting or whatever. I'm like, no, I was so excited to get it. I'm excited to get a booster.
Well, to make it's fascinating, the contrast between COVID-19 and polio. So we've all read about when polio vaccines were introduced, and they were not nearly as effective, protective as the COVID-19 vaccines. And yet the world cheered. It was front page news. Not to say this isn't front pages, but it was most people, if not everyone, celebrated. Whereas today, you've got a chunk of our community, of our neighbors, of our world, who have cheered and celebrated these vaccines, but obviously another large part of the world has not embraced them. So the world has changed, but again, these are much more effective than those early vaccines and many other vaccines, flu, etc. So they need to be celebrated. Yes,
absolutely. And it's like, I mean, even a lot of the people that have taken it haven't been overly excited to do so. And,
yeah.
In terms of people that have celebrated, like actually feel like have celebrated, that's like 30% of people maybe have celebrated for the vaccine. I mean, it's been hard for, I've had a lot of different virologists and stuff on the show, and they should be getting awards and parades and everything else, and instead they're getting harassed by people constantly, threats and
there's data
everything
that just
else.
Came out. I'm sorry, there's data just came out about how many who have spoken about just encouraging the vaccines. How many of them have been subject to abuse?
Absolutely,
outright abuse. It's startling. I write in my book at the end sort of a plea for an appreciation of those in the world of healthcare professionals, public health officials, and it is sort of sad. My book is a positive book. Yeah. It's almost a fun book, I think, because others have written what went wrong. I tried to write. My book is about what went right. So I try to make it a positive experience. I always feel if you're going to pick up one of my books, I've written a number at this point, I want it to be a fun experience to some extent and an upbeat experience. But there's still so much to be discouraged about, unfortunately.
All right, well, let's have an episode all about appreciation. So break it down. How in the world did this happen? So because I've mentioned on the show before, and I don't know if this is your take on things, but I've had past guests address the idea of like that this was a hasty thing or something like that, or that there was, there's a lot of hesitancy around the idea of like, well, there's never been a vaccine this fast before. And I've had past guests address the fact that actually it wasn't that any corners were cut or anything. It was one, there was a lot of global resources and focus and everything on it, and two, just the sheer number of cases created control groups quite a bit faster than something with like Ebola or something like that. So there's a lot of factors like that were able to move some of the studies along. But I would love your perspective on just how this happened so quickly.
So I'm going to first disagree with you. I don't think it happened quickly, in that the point of my book really is that the research went back decades, and I traced that research in terms of the key vaccine approaches. We were able to produce them quickly in 2020, thankfully. So that point is obviously an accurate one. But my book, while it's not a polemic, I do think one comes away from the book, or at least I came away from the research, realizing that this work was not done quickly. We're talking decades of hard work. So I start off with HIV and the effort to find an HIV vaccine. I do that partly because, to me, I find it fascinating, interesting characters, a lot of lessons, both for scientists, researchers, but everybody else too. But also because while that never succeeded, they're still working on it. And one of my key scientists may actually find a vaccine at some point, Dan Baruch up in Boston. While that hasn't proved successful yet, the effort led to these COVID-19 vaccines. And why do I say that? One of the key efforts was by Merck, and that was efforts to find a vaccine for HIV. And not only did it prove unsuccessful, their vaccine wasn't protective, it actually put some people at risk of getting HIV. So it was an awful, terrible, haunting experience for those scientists working on it. And I write about that in the book. And they used AD5. I guess you have a more sophisticated audience, but adenovirus 5, it's basically using a common cold virus, and you hitch a ride into the body on this AD5, and you put the gene for HIV. One of the genes or piece of a gene was another approach onto that virus, and you hopefully create a protective vaccine. So again, that was unsuccessful, and it was a awful, terrible experience. But AD5 didn't work, but it led to two other approaches. One is AD26, adenovirus 26, which is what Dan Baruch up in Boston embraced. And it was an offshoot of the Merck experience. And that eventually, Dan Baruch worked with J&J, and that led to the J&J vaccine for COVID-19. And similarly, yes, AD5 didn't work for Merck, but the chimp adeno approach was embraced by some researchers at Oxford University, and that eventually led to the chimp adeno, which is at the heart of the AstraZeneca vaccine today. So in other words, going back to, again, as in the 80s and 90s with the effort for HIV, that did lead to, and it took years of honing that approach, it led to these COVID-19 vaccines. Similarly, I start off back in 1990 when it comes to mRNA, and a researcher in Wisconsin named John Wolfe, who's doing really early, really important work. He made a little bit of an advance with mRNA. He showed it could be a little bit effective. That led to, it was almost like a relay race. It led to work done at Duke by some researchers. Elie Goldbow is his name, and some of his colleagues. They were doing it in the lab. They weren't injecting it, but they were showing how you can actually, and they were working on cancer, you can use mRNA and actually create some proteins and get the immune system to react. That in turn, again, like a relay race, led to some other academics, some more famous than others. So again, even mRNA goes back to 1990 in my telling of the story. So one should come away from my book saying, well, geez, yes, they were able to produce these vaccines quickly, and we should talk about 2020 and the remarkable work that was done. But the ground was laid decades earlier by just hard, painstaking, patient work, resilient scientists, and really impressive researchers. So that's, I think, one of the takeaways from my book.
What's your take on this Robert Malone guy that goes around claiming he was the creator of the mRNA vaccine? Do you know who I'm talking about?
Yeah, I do.
He seems like a bit of a disgruntled sort of character that is now trying to get popular through kind of being controversial. And
there are frankly a few people like Malone who did early work and played a role, and they believe they should be given more credit for the role that they played. There are others that I write about in my book. There are others that I believe did played roles. I don't think they necessarily played as big a role as they think they do. That's true often in science. One thing I've really appreciated writing about scientists is they are often very eager to talk about the advances that they contributed to. And they're eager to tell you why everybody else didn't contribute as much as they did. I say appreciate because I appreciate the honesty, and I appreciate people sharing what they've done. I come from a world where often people don't like talking to journalists. So, just the fact that they open up and talk about their work is something that I'm grateful for. But yeah, Malone, like others, they believe they played a bigger role than maybe they're giving credit for.
Mm-hmm. So yeah, I would love to hear a little bit more of that, of that origin story. That's something that we haven't talked about at all on the show. And I found I've read 2 books recently on kind of the history of pandemics generally, and it's one of the things that I think is kind of exciting about hearing this is it's kind of it's almost like a detective story or something. You see kind of some of the misunderstandings along the way, and then some of the breakthroughs, some of the epiphanies that happen, and once in a while there's a discovery made that the that field is never going to be the same. The advances made in that area create such an advance, and so much is learned from it. So could we dig into that just a bit more?
Sure. So I like to start with, and I started my book with a guy named John Wolfe, who I find fascinating. He was interesting because he was both a scientist, a researcher, but he also treated patients, and he focused early in his career, for much of his career, on young patients, pediatrics, and he treated them. So he was, he served as a doctor. He was, even when he was completing a clinical fellowship in neuroscience back in San Diego at University of California, UC San Diego, he became somebody that parents brought their children to. And he would identify rare diseases in little boys and little girls, a lot of them that doctors missed. And, word kind of spread, and people brought their kids to him. They saw him as a gifted diagnostician. And he was good at finding this stuff. And but these were devastating diagnoses. And his whole goal was to try to see if he could deal with them, maybe help these children, not just diagnose them, but they usually had some sort of defective gene, so they couldn't make some substance, it didn't operate well. So he'd go back in the lab and he'd try to find ways to help, and he'd get frustrated and it didn't go that far. We're talking like the late 1980s, and people knew at that point all about DNA, and they knew a little bit about RNA, and he really just kind of wanted to cure these kids, and he eventually moved to Wisconsin, University of Wisconsin, and he kept doing sort of on the side, and he was like an obsessive, and he'd work all night, and his kids and parents and his wife would kind of wait up, and sometimes he wouldn't be there, and he wasn't really good at much else in his life. He was a good father, but everything else he dressed oddly, and he was just sort of an unusual guy. But by about 1990, late 80s, 1990s, he was kind of focused on trying to help these children in the lab. And he wanted to see, and he came at things a little bit differently, but he looked at these genetic defects and he kind of said, well, we all know that, DNA is copied, transcribed into mRNA, which is, translated into proteins. And he was one of the first people that said, well, maybe we could just inject mRNA and healthy mRNA into the body and see if we can create healthy proteins and replace the ones that were necessary. People were skeptical. We all know historically people don't want to work with mRNA, and I write about a lot in my book. We all know that enzymes chop it up. It doesn't last long. They're unstable. And people kind of say, don't waste your time with mRNA. It's just not worth your time. But he kind of said, hey, what if we can, what if I could synthesize and deliver normal DNA? He looked at, but also mRNA without any mistakes, straight into the human cells, and just sort of replace defective cells. Reflective genes in his patients, and create functional proteins. And he tried early on, and he made some progress. People were skeptical, and he even sort of moved on, and delivery was an issue in terms of creating consistent proteins, ample proteins to really do anything. He didn't really help any of his patients, sadly, in the end. And he passed away in 2019, right before COVID really hit. But he's the first one, I would argue. And Malone worked with him. You mentioned about Malone. Malone worked with him. And again, Wolfe is the first name on the paper. Malone is the second. Malone played a role, but I'm focused more on Wolfe. So he basically injected, and he used these like crude lipids, and eventually the lipids had to be improved. He wrapped them around mRNA, and that eventually is what people at Moderna figured out the right approach. But he got shots. He showed how shots of mRNA encased by these lipids could create some proteins. Had showed that there were some proteins, and that really excited him and excited some other people. It wasn't publicized. It wasn't something that was on the front page news or anything like that. but he showed you could create functional proteins just by injecting mRNA. And I would argue that's the first step along the way.
Well, keep going. I want to hear the next step.
Well, yeah. So he published, I believe it was March of 1990. They published their work in Science, and again, it was the first successful use of mRNA. And they kind of suggested, maybe someday it would be a drug or even a vaccine. Because once you create proteins, it opens up a whole world. But again, everyone knew there were all kinds of obstacles in his way. Delivery was something that, and the key is, and I'm sure a lot of your audience is aware, but the key is that the body has these cells. They have these.
We FYI, we don't. So a lot of this show, we talk tons about how the brain works, tons of psychology, a lot of evolution stuff. So get into evolutionary biology and stuff like that. Microbiology, not so much. And we do from time to time, but it's never going to hurt us to have a refresher.
Sure.
So you wouldn't be over explaining to.
Okay, sure. So basically the idea with creating messenger RNA, which is a molecule, and it tells the body cells what proteins to make. So if you think about it, the possibilities are just remarkable. And that's why people have always kind of wanted to work with mRNA. The possibilities are remarkable because, well, if you can tell the body cells to create whatever proteins you want, I mean, who needs drugs? Who needs vaccines? You could just have the body make it itself. You don't have to pump in this kind of stuff. Let's say pieces of a pathogen, which can be dangerous potentially. You got to kill it or weaken it. That's historically how we made vaccines and all these medicines. Who needs all that stuff if you could tell the body to create it? And fast forwarding, that's why venture capitalists and other investors got so excited about Moderna. That was the whole idea of Moderna. The body itself could be a drug factory, its own drug factory. So, so if that was so exciting and so promising, why didn't people get carried away and embrace what Wolf was doing and some other people like Miller and other people doing? Well, because they teach you in, biology kind of 101 that it's hard to get mRNA into the cell and it doesn't last. And that's because there are these things called RNases. They're like enzymes. They're not like enzymes. They are an enzyme that degrade. Their whole job, they're an enzyme in the cell that degrades the mRNA molecule, usually because it's had a chance to kind of deliver its instructions. And there's a reason why the body has evolved that way, to protect it and such. So it's hard to get mRNA into the cell. And frankly, for years, people always thought that delivery, and that was the challenge. How do we get this mRNA? We can create it in the lab. We can tell the body what to do, but how the heck do we get it into the cell without the cell just chopping it up and these enzymes and they evaporate? Today, again, the people say, oh, well, I don't want to take one of these mRNA vaccines because it's going to change my DNA. Hardly, it doesn't. The whole problem always has been that mRNA doesn't last. For people that are scared that, it's going to stay in my body and change my DNA. No, the real challenge, and it still is the challenge. That's why we don't have any mRNA vaccines or drugs other than COVID, and we'll see if we can develop them, is because it's been so hard to avoid the immune system's defenses. And so getting back to Wolf, people kind of read what he did, and he got some money for a startup, and it didn't really go anywhere. But people were still, okay, but it's mRNA. And that's what this guy, Eli Gilboa at Duke and his colleagues kind of said. They had their own challenges, and they kind of said, they took the baton, and they were working on cancer, and they're the ones who kind of were really focused on immune cells and how they're going to recognize and kill tumors. That's what they were really working on. And they, in the lab, were the next group that had a real breakthrough. And they're the ones who kind of showed you can, once again, use mRNA. They were working in the lab, in the dish, not in the body yet, in vitro. But they were kind of saying, hey, we can actually, and they were working with dendritic cells, which are, these are these cells that play a really important role activating T cells and generating immune response. They were trying to help these dendritic cells fight cancer, but they took mRNA and they showed you can get, again, activity in the immune system, and they kind of shocked the world in some ways and played a really important role. And there was a lot of serendipity. I mean, you'll read about it in the book, but basically they were doing every kind of experiment possible, and they didn't really expect to make much progress. And one day, kind of one of the lab technicians, I write about it, kind of slipped in mRNA. They were using all kind of testing on everything on mice. And he slipped in just pure mRNA into one of their tests, one of their experiments. And believe it or not, it showed progress of eliminating cancer in mouse cells, and it shocked them. And they had to retest it a few times because they didn't believe it themselves. Gilboa and his colleagues and other people at the time didn't think that what they had found was really legitimate. How can you're really going to affect cancer? You're gonna take away cancer cells in the lab.
Sorry.
Sure.
Sorry, what just so I'm tracking right. Around what year is this?
1996
okay.
is when they had this kind of breakthrough. And listen, their mRNA, they treated mice with this mRNA. And it wasn't, they weren't doing that much better at getting rid of tumors, but the results were surprising. Because at the time, most scientists kind of said, again, mRNA is too unstable. You can't be a vaccine, can't be therapeutic, no matter what, Wolf had done a few years earlier. Our conventional wisdom is just for years that the cell's enzymes are going to chew up the mRNA molecule before it's had a chance to help to stir the immune system. And Gilboa showed that's not the case.
Yeah, one thing that because definitely my wheelhouse is more in kind of understanding, doing a little more of the science communication things of relating to the public, and there are what I love about people getting the chance to hear a lot of this stuff and hopefully getting them to appreciate is. I don't know if it's just, it seems, I guess it's like naturalistic fallacies or something that happen where people want things natural and organic, and that means something to people that usually isn't terribly well regulated. But you kind of mentioned people worried about their DNA being altered, and there is a fear of science. People hear a few acronyms like this and they hear like genetically modified or something. And I think I have something. I just saw something recently that I had a GMO free and everything. I'm like, well, that's not really a selling point for me. But I saw some survey recently that said something like 85% of the population is this Agricultural Institute did a survey of a list of a bunch of different things to see how to convey information to the public better. And something like 85% of people believed that food should be labeled if it contains DNA.
If it contains DNA.
If your food contains DNA,
wow, they should
DNA, put a warning label on it.
Yeah, I guess people just hear DNA.
It should be a warning if it doesn't contain DNA, if anything. If we're going to put a warning on something, but
scientific education is not maybe where it should be, I guess.
Yeah, but that's. I just wanted to say, because I think the importance of what you're doing and communicating all of this is showing people this step-by-step process of how, I always loved math as a kid. I wasn't a good student in anything except for math. And I just loved that you could show your work and you could show how you got there, and other people could kind of work it out for themselves as well. And you could arrive at this sort of somewhat consensus or whatever. And I know things like microbiology are messier than your freshman year algebra 1 class or something, but but I really, how much in your research, in doing interviews and sharing some of this research along the way with others, have you found that that it makes people appreciate this process quite a bit more? That people are like, oh, I'd never really thought about it like that before, or it changes people's minds at all?
I do. And frankly, I understand the concern. I mean, for the average person, when you hear injecting DNA and injecting mRNA, they sound kind of similar. And truthfully, injecting DNA into the nucleus of the body cells to create proteins is kind of tricky and potentially dangerous. And there have been issues with gene therapy and the patient, I think it's James Wilson, who died. And there have been sad and even tragic episodes in the past. So I do think, and we haven't been able to prove that DNA injecting it has worked. So I kind of understand why the average person might hear mRNA and get confused with DNA. But that's why, I want to tell the world that, right, this is very different. And it's been proven so far to be, thank God, relatively safe. And yeah, when you tell the full story, I think when you read the full story, I think you get more of an appreciation for the care and the concern of these scientists. And they're not out to harm; they're out to help.
How much of these advances would you attribute to actual problems being solved, and how many times along this path are there just kind of theoretical predictions of issues that might come true in the future that people are trying to find solutions for? Because you started kind of by talking about AIDS in the role of AIDS research and the I forget the guy, and Dan Burrick.
Dan Burrick, yeah.
So basically, I guess what I'm getting at is, how much of if you would have never had AIDS or never had polio, or maybe even in the early 2000s with H1N1 and the SARS and things like that have popped up, how much does the field advance when an actual salient problem like that arises, and how much of this is done in the background, just predicting things that have maybe stopped things from happening that we'll never even appreciate?
That's a good question. Well, I think in some ways your question is two-part. To answer your first part, or maybe the second part, I think you can actually make the argument potentially that you're going to look back on this era, the COVID-19 pandemic, as awful and horrible as it's been, and all the lives. And I had an uncle who died, and I've got a neighbor, so I'm well aware of the tragedy of COVID-19 and this pandemic. But you might be able to look back on it as a net positive. Why do I say that? Because we've made these advances with mRNA, and the companies that have been successful have made so much money, and now they are turning to try to attack other longstanding problems, multiple sclerosis, and I have a family member dealing with that as well. Cancer.
Me too.
These are just awful challenges that have been unable to solve, obviously for decades, and it's not clear yet whether they will have that progress. But they've got the money now, and they've got the encouragement from Wall Street and investors. And if BioNTech and Moderna and there are others as well who have embraced mRNA and some of these other approaches too, and even AIDS. If we can have breakthroughs there, it's hard. Again, it's hard to believe it right now, but you may look back and say it was a net positive in terms of public health. And going back to your other part of your question, it's not really theoretical. Obstacles do hold us back often, such as the bad rap that mRNA always had. Don't play with it. Don't use it. Don't waste your time with it. People lost their careers, and I write about it in my book, for playing around with this stuff, for using it. It was just hard to handle. And I have one little funny story where some I think it was a postdoc, or no, it was a young professor at a top university, burnt down her whole department and jeopardized her tenure because she was playing with mRNA and it was unstable. And led to a big fire internally. But it was a series of small advances, usually not appreciated by anyone along the way, that has been happening all these years. Like within hold on one second. Within Moderna.
Take your time.
Okay, here, hold on one second.
We can always edit little bits here and there.
Within Moderna, they spent years having struggles and frustrations and making little advances that no one was aware of. There's a young woman, or at the time she was a young woman, named Carrie Beninato, and I write about her in my book. And she was the one who figured out how to get, or she made a big advance in terms of delivery. In other words, again, how do we get this mRNA molecule that we've created in the lab to get it into the actual cells without the cells fighting it off, the immune system? And it was a series of really interesting, important work that she did in terms of chemicals and playing with different chemicals in the surrounding, the encasement around the mRNA. And no one knew about it at the time. No one gave her credit other than some of her colleagues. No one outside Moderna cared about what they were doing or was aware of it. And that's kind of why I wrote this book in some ways, to give credit to the unheralded scientists and researchers along the way who struggled and persevered and were resilient and finally had success. And we owe our lives in some ways to their perseverance.
Yeah. I mean, I've kind of mentioned things like this on the show in the past, but it's much in the way that we my perspective is that we should be celebrating the heroes that took part in all of this process and these advances, and but I don't anticipate seeing a parade anytime soon for them. We certainly aren't going to see many parades for the things that the pandemics that were stopped before they ever happened.
That's true too. That's true too. Yeah.
It's just so hard to appreciate the oil change that kept your engine from blowing up, and I love the idea of a shift, more money, more incentive, more researchers, more resources being put into something like preventatives, like vaccines, instead of therapeutics, which are, I mean, it's absolutely incredible, the therapeutics that exist for AIDS now, in a world where they don't exist. It's a much worse world, but those aren't without, lots of problems and lots of side effects and lots of like people having to stay on top of taking rather expensive medications very regularly and making sure people are taking them correctly and everything else. When you compare something like that to a vaccine, it's I mean, if you have kids that are born, say 50 years from now, that maybe this is far-fetched, but maybe they don't ever have to live in a world that has cancer. They would never, they're never going to appreciate that. They're never going to, never going to be like, hooray, we don't get these weird tumor things that we heard about in history books.
What about measles? What about measles and rubella and smallpox and polio? There's so many diseases that haunted our parents' generation, grandparents' generation, that we take for granted. And there was even talk now about kind of ignoring and not getting vaccinated and such. Yeah, but both the vaccinations aren't appreciated enough, and the researchers themselves. And that's one of the, I've been just so impressed by these researchers, largely because, I write about the success stories. Well, for every one of those, there's, 10 that's been in a lab and downstairs in the bowels of some basement and making small progress every day. He or she has hope, has reason to keep plugging away, but without much evidence that they're going to make much progress, and often they don't. So I give them a lot of credit.
I don't, I'm trying to keep this as, it sounds like you wrote a very positive book, and I'm appreciative for that. I don't want to be a Debbie Downer. One thing that's been on my mind, maybe you'll relieve me a little bit, is that in terms of taking things for granted, and you mentioned measles there, we have a polio vaccine. So I think measles is really on kind of a knife's edge of it. I think the way the math works out, it needs to be right around 93% or something like that of a population needs to be vaccinated from measles for there to be an effective kind of herd immunity to it. And whenever communities start dropping below that, measles starts popping. Andrew Wakefield or someone like that goes into Minneapolis and starts spreading conspiracies, and the rates go down. And sure enough, a couple decades later, measles start popping up. And I'm very worried right now with all of the where people were just kind of on autopilot in terms of giving kids their measles vaccines and everything before. We're concerned about, getting more COVID vaccines into people's arms, but I'm concerned that people are going to stop vaccinating their kids at the same rates that they were before COVID as well. And part of that is because the advances were so successful that we're privileged enough to get to live in a world where we don't have to come face to face with measles and polio and things like that on a regular basis. And because of that, we kind of loosen up our guard.
Yeah, I try to stay positive and not get discouraged. And again, I wrote this book to shed light and show that how serious-minded and dedicated these researchers are to helping us all, to public health. But it's hard not to get discouraged by the fact that knowledge, people don't care about expertise anymore, or as they used to, or a chunk of our society. We don't want to say everybody, but more people. I mean, they're ignoring their own internists, people that treated them for, a decade or two, and they trusted for a decade or two. Suddenly, they'd rather defer to someone that they saw on YouTube, who may not have any expertise whatsoever in the field. Yeah. It's a discouraging time we're in.
All right. Well, back to the positive side. So let's talk about a little more of the more modern, the things that happened in the last 20 years or so, and then moving into what happened in the year leading up to the vaccine that happened there.
Sure. So basically, what I write about in my book is how, on the eve of this pandemic, the coronavirus, in late 2019. 3 different newish vaccine approaches had advanced. And we're talking mRNA, but we're also talking the viral vector using this adenovirus approach, hopping a ride onto this virus, which you would inject as part of the vaccine and into the body, and the protein subunit, which had been used for some vaccines, so a more reliable approach, but not for everything. And basically, there were companies. There was this company, Moderna, there's a company, BioNTech, and a company called Novavax. And there's a group in Oxford. I write about University of Oxford, and this guy, Dan Baruch, in his lab in Boston, and J&J was working with them. So basically, there's 5 efforts, and they thought they had approaches that would work to vaccines. But there was remarkable amount of skepticism at the time about all of their efforts. Well, yeah, on paper, maybe you guys can come up with a vaccine, but you've never shown it. It's never been a drug that really works with these approaches, mRNA, et cetera. So on the eve of this pandemic, these researchers, these scientists thought they had pretty reliable, successful approaches, but they weren't sure. So then this pandemic, this virus emerges, and they all say, this is going to be our chance. We're going to prove the skeptics wrong. We are going to prove that our approach can create protective, effective vaccines, and they threw themselves into it. And I give them all a lot of credit because they did it early on. We're talking early in January or late January 2020, when all the experts kind of said, or the vaccine giants, well, let's see. Like, I know, again, Merck was waiting and trying to see. We're not 100% sure it's going to be a pandemic, and maybe we should work on this thing. Maybe we should. And there was a lot of internal dissension within Merck, because there were scientists who said, hey, we are the vaccine experts. We should be the ones at the forefront. But in the end, it was these kind of upstarts, these underappreciated scientists at places like BioNTech and Mainz, Germany, who said, no, we're going to throw ourselves into this thing. And they had all kinds of challenges during 2020, and we could talk about them. So it wasn't an easy process. Now we look back on it, well, they kind of, in a few months, produced vaccines, but it was touch and go for a long time.
So what are, were there any salient moments where there was like a day or a period of time where it was like, we got it. This is we figured it out. We cracked it.
So early on, they all found evidence that their vaccines were protective, or at least first that they stirred the immune system and created neutralizing antibodies, which in animals. And this is, we're talking, early in 2020. And yeah, it wasn't humans yet, but it was enough to encourage them. It was enough to kind of give them confidence. And I should also mention there were scientists they worked with, Moderna did, at the NIH. And they too, early on, were pretty optimistic. So early on, they had some evidence of just creating protective neutralizing antibodies in animals. We're talking mice, a little bit monkeys too, but it wasn't yet humans. And then they first had some kind of early phase 1 data, which was encouraging. So slowly they had more encouraging data. But for some of them, let's say Moderna, for example, they had lots of frustrations too. They had, and even they were fearful. Why were they fearful? Because they didn't have any money to produce these vaccines. They were at one point a hot IPO. They came out, people got excited, but the stock went down over time. People weren't thrilled that they had shifted to vaccines. By early 2020, they had some money in the bank, but they were already cutting costs. They had restricting travel internally. And they were torn, the scientists within the company and the others too, the manufacturing people. They said, on the one hand, we are sure we've got a vaccine that's going to save lives, COVID-19 vaccine. On the other hand, they didn't have money to produce the vaccines. And the pandemic was expanding. They had family members who were dying, literally, and they wanted to be the ones to save the day. And they couldn't. And they tried. They went to places. They went to places like Gates Foundation, other nonprofits, endowments, and tried to raise money. We're talking Stefan Bancel, the CEO of Moderna, and he kept getting the door slammed in his face. And he was like a master salesman, and even he couldn't get people to write checks to help them produce vaccines. So in other words, they made a vaccine, but they couldn't do it in bulk, and they didn't have the money. They literally needed like $1 billion, and they couldn't get it. And can you imagine sitting on a vaccine that you knew was going to protect family members, others, save lives, and not being able to produce enough of it to get going? And finally, they got lucky. They convinced the investment bank, Morgan Stanley, to buy shares. They bought over, I think it was like 1.2 or 1.3 billion dollars of Moderna's shares, and they used that money. They wrote a check. Morgan Stanley wrote a check for over $1 billion, and in turn, Morgan Stanley sold those shares to their clients. And Moderna took that check and ran. They produced lipids. They created syringes, encasements, all the manufacturing, everything that was needed. And frankly, if that hadn't happened, I'm not sure Moderna wouldn't have been able to save as many lives as it had. So it is sort of ironic. We are very critical often of big pharma and biotech, and they just care about making money. And we hate Wall Street too. They hate making money. And listen, they all they care about is making money and not saving lives. And listen, I'm at the Wall Street Journal, and often we write critical stories of both those industries. But in this case, we need to be appreciative. They stepped up and they helped us quickly create these vaccines. And again, when I say quickly, the key is, and I think you referenced it earlier, they weren't doing anything faster than usual in terms of the trials, in terms of the manufacturing, in terms of the production. It's just that they were doing it all at once. And that's never before happened, where you have drug trials while you're actually you're manufacturing the vaccines, getting them ready to ship out. You're doing the drug trial. That's never happened before. And it is potentially a model for the future.
Yeah, I mean, that would be, I understand the logic of someone's concern of you don't want something that's hastily made and corners are cut, if that's your misunderstanding, in my opinion, of the situation. But at the same time, it's like, well, how long would you like it to take? You would
right.
You would like a global pandemic to be longer, or
right. The average time it's taken historically for an effective vaccine to be produced is a decade. The record until COVID-19 was 4 years. Do you really Would you prefer that they drag their feet and take their time and spend 4 to 10 years on this thing? I don't think you would.
Yeah, absolutely. Wow, that Moderna thing, that's gonna stick with me. That's an interesting one. I did not know that. And I mean, absolutely, we should be aware that incentives can corrupt people, even unconsciously, and we can all have motivated reasoning and everything else. It's certainly the homeopathic community has had plenty of bad actors throughout all of.
Yeah. That's a good point too, right? Every industry's got a share of bad actors, right?
Yeah. And so I don't think it's all on, and it's also like, I mean, so much of this through the pandemic. I guess I should try to check myself how frustrated I get, but I don't know what the alternative to a big pharma vaccine would be. Maybe there is something in other countries, but it's like, what do you want, a homeopathic vaccine? I mean, you aren't going to make this in your bathtub.
The alternative is something like Russia, where they're using the AD5. It's a approach that has led to problems in the past. For COVID, it looks like it's okay vaccine, but it's not data that we want.
What is that? I'm
actually
not familiar.
It's using this virus, this adenovirus called, and it's basically a cold virus. And it's relative. It's more common than you would want it to be. So in other words, it's one that the body, some of the body's immune system recognizes and fights off. So it's less effective as a result, and that's why the AIDS vaccine didn't work for Merck. They were using this relatively common cold virus, and it's not that it. We have to worry that it's going to cause colds or cause ill, but it's one that the immune system recognizes and fights off. So in other words, it can't teach the immune system. That's the whole. What is a vaccine? What was a vaccine? What's the whole point of a vaccine? Vaccine teaches the immune system, educates the immune system to recognize a piece or a version of some pathogen, some illness, some disease, so that when the body sees it in the future, if it ever does, it knows, let's go, I got to go attack that thing. So again, Russia used another approach, and they're not big pharma. So you want to use that approach. It's just not as effective. China is not big pharma either. Their vaccines aren't as effective either. There's a reason why China is meeting with BioNTech, this company that worked with Pfizer. They like the BioNTech vaccines. So, I'm not sure what the alternative is other than big pharma. And frankly, the companies, the researchers and scientists I write about in my book, they're not big pharma. They are now big pharma, but they weren't in 2020. They were kind of tiny pharma. They became big pharma because they've had this success. So, to dismiss any publicly traded or scientists, companies, or even those that are private that are backed by venture capital. I mean, we need the profit incentive to get these people. It takes hundreds of millions of dollars, maybe more billions sometimes, to get some of these vaccines going, to do the research. So who's going to come up with that money? The government doesn't always have that kind of money. So we need, and listen, there are all kinds of incentives in life. Some of the scientists in my book, they want to be famous. Some of them want to save lives. Some of them want to get rich. Some of it's some combination thereof. That's fine. Right. We all got up this morning for some combination of motivations too.
Right.
So,
right.
I don't believe it's in like sort of black and white. It's all some gray. There aren't any evildoers and always and heroes either.
Yeah, I mean, and even when I said also when I said like bad actors in various homeopathic or wellness communities, I don't think that any of them are sitting there plotting. Or maybe some of them are, but I think that there's just motivated reasoning that comes along with a lot of these things that you know, you have a particular perspective, and or you make profit off of something, or you just it's your livelihood, or you're a chiropractor or whatever else, and there's reasons to take a particular perspective. And it is amazing how incredibly political all of this got. And when I say that, I guess I try to be somewhat self-aware enough to realize that I'm sure I'm falling victim to the very thing that I'm accusing others of you know, making things more political than they need to be. But it is an issue. Let's end on a really positive note. So we talked about, you know, potential with cancer, mRNA, maybe an AIDS vaccine in the future. I'm with you. I've said this many times to people that I do think that there will be a net positive that comes from this whole COVID-19 situation. What would you say, your best guess, what will be the next kind of big headline, maybe in the next 5 to 10 years, that will come about, the next big advance that will come about because of COVID-19, because of the catalyst that happened during this time?
It's a good question, and it's hard to predict these things. I think the next thing we should look for is a universal kind of coronavirus / flu vaccine, a much more effective flu vaccine. And you have to remember, millions of people who die of flu, so that'll be really very helpful. I do think using mRNA and some of these other approaches is going to help there. I think in the near term, you also might see a vaccine for RSV. RSV is a disease, a virus that kills many, both babies, infants, as well as elderly. And we've struggled to come up with, for history, I read in my book, some of the same people working on COVID-19 have spent their careers, we're talking decades, trying to tackle RSV. I'm very optimistic when it comes to RSV. Companies like Moderna and others have seen reasons for excitement. Some other diseases too that aren't as publicized, aren't as famous, but I think we're going to make some headway. And then down the line, I'm hopeful when it comes to cancer. Listen, there are reasons to think that maybe mRNA won't be as applicable to everything that we hope. It's not magic. One of the problems is targeting parts of the body. And for some of these vaccines, you're going to need to target specific parts of the body, as opposed to the coronavirus and protecting from COVID-19, where you don't need to. It's in some ways much easier. But I've got all kinds of reasons to excite me, and also, frankly, speaking to the executives, speaking to the scientists, speaking to everybody at these companies and these different groups and government and non-government, I know that these guys are not sitting back and counting their cash right now. One thing that's really struck me about some of the research, especially at places like Moderna, is they're a mess. So they own shares. Some of them are billionaires. Some of them don't have to work anymore, and yet they're psychologically they're destroyed after this past year, because they literally been working 27, maybe not 24/7, but they're on very little sleep right now. And I don't want to be portrayed as like so empathetic of big pharma, but I am appreciative of how hard they've worked, and they continue to work. And they're getting a lot of criticism now for not sharing the vaccine abroad in third world countries, and I get that. I think there are ways to have a compromise there, and I think they're trying hard. I really do. The people that I've talked to there, but I know they're working flat out on and pivoting, and we're talking BioNTech too, this German company that I write about. They're pivoting to every other disease and ill out there that they're trying to cure, and use mRNA, but these other methods too. So I can't wait to see what they do next.
Well, since you mentioned getting the vaccine to other countries, that is something that it is a huge concern. As frustrated as I might be here in the US that we still have a large percentage of the population that could get the vaccine and doesn't. I don't know enough about the logistics of this stuff. It almost seems like it would be cheaper or easier to just get the vaccine to willing people that would actually take it in other countries to prevent variants and other things like that from taking off, which I know that's not the responsibility of a big pharma company or anything, but from the government perspective, I'm surprised that there's not more being done to get the world vaccinated.
Yeah, I wish there was more being done. There are a lot of explanations. It's not easy to get these vaccines often to other countries. The mRNA ones need to be kept at cold temperatures. Not every country has that ability to store super cold temperatures, otherwise degrades. Handing over the tech, people say, well, they should hand over the technology. They should hand over the IP. Just handing it over doesn't do enough. It needs to be manufactured. These companies have literally spent years perfecting their manufacturing techniques. Now, you can't overnight just start manufacturing in a traditional facility in other countries. So there needs to be work done, and it takes time. I'm trying to be patient with them, and I'm trying to be hopeful that we will be able to help others less fortunate than ourselves.
Well, thank you so much for sharing these stories. This is really fascinating.
Sure.
I'm so excited for listeners to check out the book, which at the time that this episode is released, again, just came out yesterday. So brand spanking new.
Nice.
A Shot to Save the World.
Yes.
The inside story of the life or death race for a COVID-19 vaccine. Gregory Zuckerman, thank you so much for joining me.
It's a pleasure. Have a great day. And I invite people to reach out to me and give me their thoughts on the book, and love to have an exchange of ideas with people.
Thank you so much. And thank you, listeners, for being such wonderful, curious people. We'll talk with you more next week.